Hello, and welcome to Cape Ann Report, the weekly show about people and programs around Cape Ann. I'm Greg Bover, and I'm your host this week. My guest tonight is Adam Curcuru, who is the Director of Veterans Services for the local district and an Iraq vet and a Gloucester native. Welcome to the show.
Thank you, and thank you for having me on the show tonight.
One of the first things it seems like we ought to clear up is who are the people that you serve, because I understand it's not just Gloucester, it's a wider range of geography.
That's right, Greg. So we serve now, starting July of last year, 2015, we've just finished our first year of our Veteran Service District. So we formed a Veteran Service District with Gloucester, Rockport, and Manchester. So we now serve the roughly 4,000 to 5,000 veterans that live in those three communities. And we assist them with filing claims and navigating VA resources.
So veterans who are Essex residents
They go to Ipswich.
I see.
They're part of the Northeastern Veteran Service District that falls under Ipswich, along with other communities stemming past Ipswich.
So you said your duties are to help veterans with their benefits and their association with each other, and why don't you just tell me
Sure.
what all you have to do?
So in a hub and spoke type of way, we're the kind of hub to initiate veterans and their dependents, being spouses, children, to available resources at the state and federal level. Massachusetts is a wonderful state to live in for veterans and families, as they've recognized that the federal government has a ton of resources available to veterans and their families, but some of those resources can be difficult to navigate. So under Massachusetts law, each community with over 12,000 population will have a full-time veterans agent. Less than that, they'll have a part-time agent. And what their duties are is to assist in the same capacity that the veteran would fill out the claims by himself. But we do it repetitively, so we become a little more familiar, and we go out and look for those resources to assist veterans. And then we help them navigate through those federal resources, through state resources and local resources, as well as resources within our community that are outside the VA realm that may be available to assist them.
So you mentioned the VA, and I think for civilians it may be confusing what the difference is between your office and the VA. So you help people deal with the VA, is that right?
That's correct. So we're not the VA. We're Veteran Services. We're employed by the community, by now the three communities, Gloucester, Rockport, and Manchester, and we assist you or the veterans with navigating the VA. VA is at the federal level, so we can help veterans in filing for claims, but we're not necessarily the VA, so we can't dig down deep into your file and be able to immediately look into your claims and look into your medical jackets. Under the VA, it's protected by HIPAA. We can't access those. But what we can do is refer you to the available resources and help you navigate the vast number of numbers that are out there to contact and pinpoint which one you should contact in order to help you with that particular claim.
So you can advise people on who they should talk to and when and that sort of thing.
Yes. So what we can do is, for a lot of the claims, we can help you fill it out as yourself. So a lot of the VA claims that are available on the internet. You can look them up yourself, and they contain a whole instruction manual on how to do that. Or you can come see us and we can help you fill them out. We've done it repetitively. We have a basis down on how we can do this, and we can help you. But once it's finished, it's as if you had filled it out yourself.
I see.
So once it's gone over to the federal government, I don't have access to that claim. It's in the federal database, and only you as the veteran can call the VA and ask those specific questions about your claim.
I see. And a little bit more about the VA. We have a new clinic in Gloucester, is that right?
We do. We opened up a new clinic this summer. It moved from Addison Gilbert Hospital on the second floor down to 199 Main Street in Gloucester. It's a beautiful new facility that offers primary care, blood testing, and also on certain days mental health counseling. One of the biggest issues that we have with veterans is getting through to the clinic. Veterans need to be aware that the clinic itself cannot triage phone calls, that the VA has a number that's available in order to assist veterans with navigating the VA clinic and directing them to their health director.
So that's the first step, is to call that number, and then they'll help you from there.
Let's backtrack a second.
Okay.
Every other Friday, we have a VA healthcare enrollment specialist come down. And every other Friday, that individual can assist a veteran in enrolling in VA healthcare.
I see.
Get them into the system. Once you're into the system, yes, then you would call the VA number, and they would schedule for your primary care appointment at the new clinic in Gloucester.
So you also are working with families, you said, not just the vets themselves. And can you tell me a little bit more about that?
Sure. We start with the active duty members. We start with making that connection with the active duty men and women prior to them becoming veterans.
I see.
We make that relationship with them, so when they do come home, they come down and start with the office, and they've already had that pre-foundation of a relationship established, so that they're more willing to come in the office and look for the resources available. We're not a stranger to them when they are finished with their active duty time. We're almost like family at that point. Currently probably have about 150 members from Gloucester, Rockport, and Manchester serving on active duty. There may be more, and what's important is that families that have an active duty service member come down to the office and let us know that their family members on active duty, so that we can kind of keep an eye out for them while they're on active duty. If they need anything, that we can assist with them. As of right now, we're getting ready to ramp up into Veterans Day, and the biggest thing associated with Gloucester and Veterans Day is sending care packages to the troops overseas. So for the next couple months, various organizations such as the Elks in our office and the Gloucester Democratic Committee will be collecting supplies for our troops both overseas and at home.
So just to make it clear, the various branches of the military do not inform you when someone becomes a soldier, sailor, Marine, Coast Guard. It's the person themselves or the families that let you know that this person is active military.
That's correct, and it's correct on both ends. It's the same thing when they leave the military. The military doesn't make us aware that they've come home or become a veteran. So it's equally important that when they get out of the military that they let us know that they're home. We usually find out about active duty service members through the ROTC program, or through the Sea Cadets, or through word of mouth through a family member, or the most common one, which everybody that crosses the 128 bridge knows, the signs, the banners that go across the 128 bridge that say "Welcome Home" to that specific family member, and that's how we find out who's on active duty.
So one of the things that I think flies under the radar a little bit is that we have an active military station right here in Coast Guard. Gloucester station is active military, and I'm not sure a lot of people think about that, but those men and women that serve there are also people that your services can benefit. Is that right?
That's correct. We've worked very closely with Coast Guard Station Gloucester. I think they're often overlooked because they're right in front of our face, and we're always looking overseas for our military, and sometimes we forget that we have active duty military protecting us at home and keeping us safe at home in an efficient fleet. Our Coast Guard is very important to us, and they are part of our family. Last year, being part of that, sending care packages was creating 35 Christmas stockings with the first name of each Coast Guard member at Coast Guard Station Gloucester, filling them up with good little, candies and cookies and basic toiletries that they could keep on station. And we brought them down with our volunteers, and the mayor joined us in showing our appreciation to the active duty station in Gloucester and letting them know that, they're not forgotten. They are so important to our community, and they do so much for us, and we're so appreciative of their service.
Well, I agree. They give back a lot to the community. Their support of Sea Scouts and a lot of other programs in the city wouldn't happen without them, I think.
That's correct. You're right.
So one of the other things that we talked about in the green room is the book you brought with you.
Yes.
And why don't we talk about that now, too, so other people can see what this is all about.
So we received this a copy of this book during our veteran service training, which we have to do to maintain our credibility as a veteran service officer. So we received a copy of this from the Massachusetts Secretary of Veteran Services, Secretary Urena, as an idea that we could bring veterans into our schools. So we were very fortunate to have a private donor donate $20,000 to our office, and we're very thankful for Mr. Mike Minogue's and his wife Renee Minogue's donation. And with some of that money, we purchased 42 copies of this book, which we're planning to read in the elementary schools, the K1 and 2 grade, the week before Veterans Day, and have that veteran donate a copy of that book to the classroom, to be in the classroom, and to hopefully those veteran readers will be some of our veterans in our community that have children in those grades, that can build that relationship between the student and their parents or grandparents that have served our military, and really relate the book to home, where it's veterans, heroes in our neighborhoods, where we often overlook some of the veterans that are here, and build that relationship with our students.
One of the other things that you mentioned is your weekly Veterans Network meetings.
Yes, so every Friday morning we host a veterans networking group between the hours of about 8 and 9:30. It's very generic. It's not anything formalized. What we do is we have a cup of coffee and some donuts with local veterans, and they talk about whatever they want to talk about, and they meet and mingle with each other. Oftentimes various resources will come down and join us. Many different resources from the VA will pop in on various Fridays. We have an individual that comes down that can discuss the VA home loan, whether refinancing or using it for the first time. We even have some of our local resources outside the VA, such as Beauport Hearing and Senior Care, that pop down at times to assist in their particular realm with veterans.
Well, we're almost out of time. Where does this happen again?
This happens at 12 Emerson Avenue at the Veterans Office.
Okay,
Big
so
red barn building.
People can come down and see you there.
They're all more than welcome to come down and see us.
Well, thank you very much for coming in and explaining all the great things that you do for our local veterans. That's all the time we have this week. Thank you for watching. I'm Greg Bover. That's the Cape Ann Report.